Did you know that nearly 47% of people in North India are deficient in vitamin B12, and about 76% of the population across India is deficient in vitamin D? This means that the majority of us are walking around with nutrient levels far lower than what the body needs to stay healthy. India is currently facing nothing short of a vitamin D deficiency epidemic. And here's something important. Many everyday health issues don't come from serious disease at all. Very often, they stem from the lack of just one particular vitamin or mineral. Even conditions like high blood pressure, chronic fatigue, eczema, depression, poor concentration, and even reduced fertility or low sperm count can sometimes be traced back to deficiencies. In such cases, when the missing nutrient is restored, the symptoms often naturally reduce or even disappear. In this video, I'm going to walk you through 5 of the most common vitamin and mineral deficiencies, what signs to look out for, and most importantly, the simplest and most natural ways to correct them, without relying on expensive supplements. But before we dive in, I'd love to know, where are you tuning in from today? Leave a comment below with your city or country. I always enjoy seeing where everyone's watching from. It creates a sense of connection, no matter how far apart we may be. And don't forget to like this video and subscribe for more wellness tips like these. You really don't want to miss what's coming next. So let's begin. Among all vitamins, vitamin D deficiency is the most widespread, with research showing that around 75% of Indians have levels below the healthy range. And vitamin D is not a minor vitamin. It plays a crucial role in strengthening bones and teeth, supporting muscle function, boosting the immune system, improving energy levels, supporting mental and emotional well-being. When vitamin D levels are low, bones and muscles begin to weaken. People often complain of constant tiredness, even if they eat well and sleep enough. Frequent muscle cramps and joint pain become common. The body becomes more prone to colds, flu, and infections. Some may even experience irritability, mood swings, or mild depression. One major reason this deficiency is so widespread is surprising. Even though India has ample sunlight all year round, very few people spend enough time outdoors. And even when they do, sunscreen, clothing layers, and pollution block UV rays, preventing the skin from producing vitamin D. Yes, scientifically it does. Multiple studies confirm that sun exposure is the most natural and efficient way to raise vitamin D levels. For example, a study conducted in Spain found that in summer, when about 25% of the body is exposed, just 8 to 10 minutes of sunlight daily can be enough. But in winter, when less skin is exposed, it may take up to 2 hours to make the same amount, something that is not practical for most people. This is why traditional Ayurvedic practices suggest exposing the navel and the back while sunbathing. These areas are highly effective at absorbing sunlight. If tanning is a concern, you can try a head shade or umbrella cap that blocks sunlight only from your face while allowing the rest of the body to absorb sunlight naturally. There are very few natural food sources of vitamin D, which is another reason deficiency is so common. However, there is one powerful natural food source: mushrooms exposed to sunlight. Scientific research has shown that when mushrooms are kept in the sunlight before cooking, their vitamin D content increases dramatically. Place mushrooms in direct sunlight for at least 1 hour before cooking. This is one of the most natural, affordable, and effective ways to improve vitamin D levels through food. Let's talk about supplements, because this is where most people get confused, especially when it comes to vitamin D and vitamin B12. Starting with vitamin D. In the market, you'll generally find 2 main types of vitamin D supplements. 1. High-dose synthetic, allopathic, vitamin D3 tablets. These come in doses like 20,000 to 60,000 IU. They are usually prescribed when your vitamin D levels are very low and you need quick improvement. 2. Plant-based vegan, vitamin D3 supplements. These are much lower dose, around 600 to 1,000 IU per serving. These are safer for daily use and can help maintain healthy levels over time. Now, here's the practical approach. If your vitamin D level is severely low, your doctor may advise you to take 20,000 to 60,000 IU weekly for a few weeks. This brings levels up faster. However, this should generally be taken only for about a month and always under medical guidance. On the other hand, plant-based vitamin D supplements don't work as quickly because of their lower dose. They are better for long-term daily use, especially if your levels are just slightly low or you want to maintain good levels without side effects. One important point many people don't realize: taking very high doses of vitamin D for too long can lead to calcium deposits forming in the body, called calcification. This can become harmful for the kidneys, blood vessels, and even the heart. To prevent this, vitamin D should always be balanced with vitamin K, especially vitamin K2, because it helps move calcium into the bones, not into the arteries. This is why many vitamin D3 supplements also include vitamin K. But you can also get vitamin K naturally by using cold-pressed oils, eating leafy greens, and including foods like dried figs in your routine. Now, moving on to vitamin B12. Vitamin B12 plays a crucial role in red blood cell formation, DNA synthesis, brain and nerve function, energy production. So when B12 is low, you may experience constant tiredness, mood swings, anxiety or depression, memory problems, tingling or numbness in hands or feet. In fact, doctors often check vitamin B12 levels first when someone reports unexplained fatigue or mood-related symptoms. Vitamin B12 levels should ideally be between 200 to 950. If it falls below 150, it can not only affect your energy and mood, but also increase the risk of autoimmune problems. So why does B12 deficiency happen? Not eating enough B12-rich foods, common among vegetarians. Poor gut health, meaning your body cannot absorb the B12 properly. Regular use of antacids, which reduces stomach acid needed for B12 absorption. Taking diabetes medication like metformin, which is proven to reduce B12 levels. Drinking RO or distilled water, which is demineralized and lacks cobalt, an essential part of the B12 molecule. Plus, it lacks the beneficial bacteria needed to help produce B12 in the gut. This is why gut health matters. The healthier your gut bacteria, the better your B12 levels. To naturally boost vitamin B12, eat fermented foods daily such as idli, dosa, dakla, congee, and homemade pickles. Consume milk and curd regularly because they contain both B12 and good bacteria. And here's a powerful tip that works shockingly well: moringa leaves. If you mix dried moringa leaves into chapati flour, add them into dal, rice, or vegetables, and use it consistently for about 2 months, your B12 levels can improve significantly. This works because moringa provides micronutrients that support gut bacteria, which in turn boosts natural B12 synthesis. If you cannot find fresh moringa leaves, ask a local gardener for a bunch. Dry them in the sun. Store them in an airtight container. Use a small amount daily when cooking. And if you prefer supplements, there are several vegan B12 supplements that are based on moringa, wheatgrass, and fermented herbs. These are generally safe for long-term use and support natural absorption. In short, use high-dose vitamin D only temporarily and only if your levels are very low. Combine vitamin D with vitamin K to prevent calcium buildup. For vitamin B12, focus on gut health, fermented foods, and moringa for long-term improvement. Now let's talk about zinc, because even though the body needs it only in small amounts, a deficiency can create surprisingly serious health issues. Zinc is involved in over 300 biochemical reactions in the body. This includes cell growth, immune function, protein synthesis, taste and smell regulation, skin repair, and yes, hormone production. So when the body does not get enough zinc, symptoms can show up almost anywhere. Common signs of zinc deficiency include excessive hair fall, slow wound healing, reduced sense of taste or smell, persistent skin issues like rashes or eczema, frequent diarrhea, and in men, low testosterone levels, low sperm count, or erectile dysfunction. In fact, when men visit doctors with sexual health concerns, one of the first nutrients they are advised to increase is zinc. This is because zinc plays a central role in testosterone production and the health of male reproductive tissues. Without adequate zinc, the body cannot maintain normal hormone balance. According to recent health surveys, nearly 30% of people in India are zinc deficient, and this number is projected to rise. Why? A big reason is the shift from natural, homemade foods to processed and convenience foods. 2 decades ago, fast food like pizza, noodles, and packaged snacks were occasional treats. Today, they are a daily habit for many. These foods are not only low in zinc, but they also contain additives that disrupt nutrient absorption. You may say, but I eat home-cooked food every day. Then why am I still deficient? Here is one highly overlooked reason. not soaking grains, lentils, seeds, and nuts before consuming them. Whole foods like dals, beans, millet, rice, and nuts contain phytic acid. Phytic acid naturally binds to minerals in the digestive tract and prevents absorption, especially of zinc. So even if you are eating healthy foods, you may not be absorbing the minerals. To prevent this, Ayurveda and traditional cooking methods emphasize soaking. Wash and soak lentils before cooking for at least 4 hours. Soak rice for at least 30 minutes before cooking. Soak nuts and seeds overnight and eat them the next day. And very importantly, use the same water in which lentils were soaked for cooking because it contains released minerals. So the key is, whole foods are only beneficial when prepared correctly. Next up is zinc, a trace mineral that, despite being required in small amounts, plays a critical role in numerous bodily functions. Zinc deficiency can lead to a host of concerning health issues, including hair thinning or hair loss, slow wound healing, loss of taste or smell, skin rashes, eczema, diarrhea, and in men, reduced testosterone levels and sexual dysfunction. In fact, zinc is often the first nutrient doctors focus on when addressing male sexual health problems, such as erectile dysfunction or low sperm count, because it directly supports testosterone production. Studies suggest that nearly 30% of the Indian population is zinc deficient, and this number is rising due to increased consumption of processed foods. While processed foods were occasional treats decades ago, they have now become a dietary staple. Think pastries, pizza, burgers, and packaged snacks, reducing intake of zinc-rich whole foods. Even if you follow a seemingly healthy diet at home, zinc deficiency can still occur if you're not preparing foods properly. For example, soaking grains, lentils, and dry fruits before cooking or eating them is critical. Soaking reduces anti-nutrients like phytates that bind zinc and block its absorption. Traditional Ayurvedic guidance emphasizes washing and soaking lentils for at least 4 hours and using the same water for cooking, which significantly improves mineral availability. If you follow these simple steps and eat a diet rich in whole grains, pulses, nuts, vegetables, and dairy, you can maintain healthy zinc levels naturally. Supplements are rarely necessary unless prescribed by a doctor, because excessive zinc intake can cause gastrointestinal and neurological issues. Next is folate, also known as vitamin B9, a vital nutrient responsible for repairing cells, synthesizing DNA, and producing new blood cells. Folate deficiency affects approximately 35% of Indians and can manifest as mouth ulcers, fatigue, a red tongue, or yellowish skin. Pregnant women are especially advised to supplement folic acid, as insufficient folate can lead to severe birth defects, including neural tube defects affecting the brain and spinal cord. The main cause of folate deficiency is poor dietary variety. Eating the same types of dal, grains, or vegetables consistently without rotating seasonal produce can limit folate intake. Experts suggest rotating different dals, grains, and vegetables according to the season to prevent deficiency in most cases. Foods naturally rich in folate include green leafy vegetables, beetroot, citrus fruits, bananas, and papaya. Supplements are typically unnecessary unless symptoms like persistent mouth ulcers arise. In such cases, folic acid tablets or B-complex capsules can be taken under a doctor's guidance. Next, let's discuss a mineral deficiency increasingly linked to heart issues in young Indians: magnesium. Magnesium is essential for over 300 biochemical functions, particularly for cardiovascular health. It relaxes blood vessels, ensures smooth blood flow, maintains normal heart rhythm, and helps regulate blood pressure. Research indicates that magnesium deficiency is a common factor in over 80% of heart attack cases. Symptoms of magnesium deficiency include muscle cramps, morning stiffness, neck or back pain, and high blood pressure. Factors contributing to deficiency include regular consumption of diuretic beverages, alcohol, tea, coffee, soda, and overuse of synthetic calcium supplements, which can block magnesium absorption and cause calcium deposits in arteries. Magnesium is abundant in green leafy vegetables, green beans, capsicum, cucumber, bottle gourd, pumpkin seeds, sesame seeds, nuts, bananas, and grains like bajra and little millet. If dietary intake is sufficient, supplementation is usually unnecessary, though magnesium glycinate can be taken under medical supervision if needed. Another nutrient crucial for heart and bone health is vitamin D, which is deficient in approximately 76% of Indians. Low vitamin D can cause muscle weakness, joint pain, fatigue, mood swings, and increased susceptibility to infections. Vitamin D is also essential for calcium absorption. Without it, calcium supplements won't strengthen bones effectively. Despite abundant sunlight in India, deficiency is common because most people stay indoors or use sunscreen, limiting UV exposure required for vitamin D synthesis. Studies show that exposing 25% of the body to sunlight for 8 to 10 minutes daily during summer is sufficient, while in winter, longer exposure is needed. Food sources include sun-exposed mushrooms, which can dramatically increase vitamin D content if left in sunlight for 1 to 14 hours before cooking. Supplements are available as high-dose tablets, 20,000 to 60,000 IU, for rapid correction, or daily low-dose vegan D3 supplements, 600 to 1,000 IU. High-dose supplementation should always be guided by a doctor, and vitamin K should be included to prevent calcium deposition in arteries. Finally, vitamin B12 is essential for red blood cell production, DNA synthesis, and nervous system function. Deficiency can cause fatigue, mood swings, depression, and in severe cases, autoimmune complications. Nearly 47% of Indians are deficient, particularly vegetarians or people with poor gut health. Medications like metformin for diabetes and frequent antacid use can block B12 absorption, while demineralized water removes cobalt, a key B12 component. B12 can be supported through fermented foods, milk, curd, and morina leaves, which are particularly effective. Adding morina leaves to dals, rotis, or vegetables regularly has been shown to boost B12 levels significantly within 2 months, based on personal and clinical observations. Vegan supplements derived from morina or wheatgrass can also help, though dietary sources should remain the primary approach. If you prioritize fresh, home-cooked meals, a variety of seasonal vegetables, soaked grains, and fermented foods, deficiencies in vitamin D, B12, zinc, folate, and magnesium can largely be prevented. Regular testing and small lifestyle adjustments can restore your energy, immunity, and overall well-being naturally. If you found this video helpful, like, share, and subscribe to Healthy Life. Implement these practical, science-backed strategies and take charge of your health today. Thank you for watching, and I'll see you in the next video.